Thank you. And we will go ahead and get started. So I just hit record. We are recording this. We will add it to our website so that you can go back and watch it if you missed anything, or if you ever miss one of these meetings, you are more than welcome to go back to watch it and join in on any discussions that we have. Live transcript is available at your toolbar, on your toolbar at the bottom of your screen. There should be a CC if you need live transcript. Just click that and turn it on and you'll have the live transcript for you. This is our agenda for today. We're going to go through what's been going on in the PFA network the last 3 months. We'll give an update on our DEI Leadership Council and have a discussion about alignment with current projects. This is our check-in question for today. And since we have so many wonderful people on today, we'll go ahead and give us your answer in the chat box. Let us know where you're calling in from and your name, and what was or is your favorite treat from the ice cream truck. So it doesn't have to be just these options here on the screen. This was just a fun picture, but let us know your favorite ice cream truck treat. Mine, I will say, I'm Laura Jackson. I'm the Director of Communities for PFCC Partners. I am currently located up in Eugene, Oregon, and my favorite was the Choco Taco that unfortunately recently got discontinued. So sad day for me, but let us know in the chat your favorite treat. Oh yeah, everyone says drumstick. Those are a staple in our house right now too, drumsticks. Ooh, ice cream sandwich, anything chocolate, ice cream sandwich. Ooh, lots of ice cream sandwiches, love it. Drumstick. Yes, Lindsay's snowstorm that came with a wooden spoon. I can still taste the wooden spoon with those those ice creams. Bomb Pops, oh yeah. Ice cream sandwich. Choco Taco, another Choco Taco lover, love it. Oh my gosh. Push Pops, oh yeah. All right, thank you, everybody. If you haven't yet, keep adding your answers into the chat there. These are agreements that we share for every meeting. So we agree to practice active and empathetic listening and sharing, challenge the idea and not the person, be both teachers and learners, take space and make space, stories stay and lessons leave, use I statements, one person speaks at a time, and be here now. This is our PFA network heat map. It's always fun to see where you all are. We have had 2 new members in the last few months, James and Terry. I don't know if either one of you are on. Let me check my list here. I don't see either of them on, but we look forward to having them join us in future meetings and participate all over the place, engagement opportunities, the forums, and yeah. So that is our PFA network updates. These are the engagement opportunities we have open right now. We currently have the technical expert panel for home health QRP and hospice QRP, health equity quality measure development. I have to read over here in my notes because there's lots of acronyms in that, but they are the CMS is coordinating with ABT Associates to solicit input in a proposed health equity structure composite measure for both home health quality reporting program and hospice quality reporting program. That's hard to say. So they are recruiting for home health, hospice, and health equity stakeholders, including providers, patient advocates, quality improvement organizations, and health equity experts to participate in the TEP. I will add the link for more information because that was a lot of information I just gave you. There's the link for more information to that in the chat as well. We also have Putting Care at the Center 2022. That is Camden Coalition and Adventist Health are putting on their conference in September 21st through the 23rd in Sacramento. They are also offering free registration for their virtual version of the conference for patient family advisors. I will put that information in the chat for you as well. Yes, Libby.
Thanks, Laura. You're doing such a great job rolling right through. I just wanted to make a comment about the TEP, the Technical Expert Panel. I think many of you on the call have participated in these and bringing the patient family perspective into it, and many of you on the call have not. And I just wanted to pause for a quick second and really invite you in if you have not yet participated on these expert panels. These are federally convened panels. And so if you're thinking about, man, I'd like to try to tiptoe into some of the federal waters, please feel free to respond to this. We will give you all the support you need to participate fully. And this would be a great place. I'm looking at Rosie and Mary and Connie and others who have done this to provide some peer support to newer members coming forward. So the more we push the walls for more diverse perspectives involved in these, they can sound intimidating. So I wanted to just hold space to say, welcome in, the water's fine, and we'll help you swim. We'll be your floaties.
Yes, thank you.
Because there's a few more of these coming up too.
Yes, yes.
Libby, we're not scared.
I realize you have confidence, Nadine. I'm wanting to spread that around and sprinkle it to those who have are a little newer into the water.
Yes, thank you.
Libby, just about that particular TEP. First of all, I second what you said. It's a great experience. You learn a lot. I applied for that one, didn't hear, and then got an email saying that their email system had been messed up for a while, and they'll get back to me. So if anybody did apply but hasn't heard back anything yet at all, you might want to reach out to them again and say, hey, did you get my application?
We can follow up with them as well, Barbara, and kind of
Okay.
see where they are with that. Thanks for letting us know.
Yeah, thank you. All right. Okay, thank you all. And then the last one on there, I have in our pediatric forum on the website, the, again, reading from my notes here, the Board on Children, Youth, and Families Forum for Children's Well-Being. They are calling for nominations for their forum. So this is the link to the forum, our forum post with the information on that, maybe. There we go. They are looking for approximately 4 volunteer experts in many different fields, from implementation science to health equity, public health, pediatrics. So those nominations are due by August 19th. So if you or someone you know is interested in that, all that information there is on the PFAnetwork forum in the link I just put in the chat. Any questions on any of these? No. All right. If you think of anything, feel free to put it in the chat or let me know. You can always email me Laura at pfccpartners.com. I'll put it also in the chat. And let me know if you have any questions. All right, our next coffee chat for August is next Friday, August 19th. We have Connie Montgomery, who is actually on the call today. She was told her story in an article called Black Women with Bleeding Disorders Are Striving to Be Seen and Heard. So she's going to come on and talk a little bit about that in our next coffee chat. Connie, I don't want to put you on the spot, but if you want to have any other words to say about that, I invite you to now.
Thank you so much, Laura. Looking forward to spending that time Friday, August 19th with everyone. Just going to share a little bit about my story and my health journey and trying to access the services that I needed so desperately, and also share some strategies and solutions to when you need help asking for it. So I look forward to talking with everyone then. Thanks.
Thank you. We look forward to it too. And that's next Friday, 9 a.m. Pacific, 11 Central, 12 Eastern. Our DEI, our Diversity, Equity, Inclusion Leadership Council has been hard at work. We have a few projects in the works right now. One is a movie night with the whole PFA network. We are looking to do a viewing of The Color of Care, which was an Oprah documentary. We're in the process of scheduling the viewing opportunity right now, so everything is in the early planning stages. You have all, of course, will hear more information about that as we get the planning underway. But we are going to view the movie, and then the DEI Leadership Council will lead a discussion on that, on the movie. So we look forward to sharing all that information as we get it with you all. We are also in planning of an unconscious bias peer learning opportunity. So look forward for that. That's going to be, I believe, a two-part, kind of like our skills development opportunities, and on unconscious bias. And we are excited to present that to you all as well. Oh, and thank you, Lindsay. Put the coffee chat link in the chat.
And just a comment on that unconscious bias training. This is a training that Ayadola Anashe, who's one of our DEI Leadership Council members, created a couple of years ago, actually, and then has presented it in several different industries, so even outside healthcare. So it's really kind of a overall, and really excited to have her lead that effort.
Mm-hmm. Yeah, it's going to be a good one. I'm excited for it. Oh, Libby, while I have you, Brandy's asking if the TEP engagements are in person or virtual.
Those are virtual at this point.
Cool. Yeah. Thank you.
Mm-hmm.
All right. Oh, yeah, okay. By now, hopefully a lot of you have heard about the Pass the Mic campaign. This is the PFA Network's campaign for an effort to amplify voices which remain underrepresented in our journey towards improved healthcare for all. So if you have an opportunity to pass the mic, we would love for you to do that. This can be for patient family advisory councils you're on, speaking engagements, technical expert panels, any of the engagement opportunities that you see come through. If you want to pass those along, we would be so excited if you did. If you don't know anybody, if an opportunity arises for you to pass the mic and you don't know who to pass the mic to, just let me know. Again, my email is there on the screen. We will go into the network and find someone for you to pass the mic to. There are 3 ways to pass the mic. You can invite a friend or a peer who represents a community different from your own to upcoming meetings or those opportunities. You can request that your health system include additional voices, or the next time you're invited to a new opportunity, just bring a friend along and have them join you. And of course, always provide ongoing guidance and support to help that peer feel heard and engaged. And we're always here to help you as well. So that is our Pass the Mic campaign. We have been spreading the news. Does any questions or comments on that?
I'm curious if anybody here has had an opportunity to pass the mic.
This is Rosie. I've done it a few times in different occasions, and I have one right now. And I just had a request 10 minutes ago from an organization wanting to know if I knew someone who had some information about monkeypox, or was a patient that is dealing with monkeypox, or a caregiver of someone that's dealing with monkeypox. They would like to do an interview with them. It's kind of like, it's a group that I'm working on some interviews with, and they would like to do an interview. I would probably be the person doing the interview of the person who has the monkeypox or has involvement with monkeypox. I do not have anyone, so I'm passing the mic because in this area, we've got a few cases in our state, but not as many as some states have. So.
Anybody?
Or if you, Laura, I can put my email in the chat, and if anyone knows of anyone or would like to pass the mic, or let me pass the mic to that person, or you might want to introduce us, and I can take it from there.
Yeah, great.
I know there's been a lot in Los Angeles, Rosie, so I'm sure that if we put it out broadly, we can make that connection.
You were my first thought.
Nice to know.
So I have been passing the mic all over the place, which has been so much fun to see more people getting involved and less of me and more of all of you. And in some cases, I did it in the way that I think it's the fourth, that when I was invited in, I just brought some people with me, and that's been just such a great way to do it and be able to support them as they're engaging in these new activities. And so I've we've got Ting is jumping in with National Quality Forum, and we've got Deneen we passed the mic to, and then she, because of where she was speaking, she got invited to 3 other things. This is exactly the kind of thing we want to see more and diverse, and it's just so exciting. I think as someone who's been passing, I feel like I'm doing my part to really make sure that we're amplifying voices that haven't been heard, and really raising the capacity of the PFA network overall at the same time. So I really encourage you guys to give it a try if you haven't already.
Thank you. I like that. She got more opportunities from the opportunity. That's really cool.
That was an unanticipated benefit.
Yeah, definitely. Janice?
I've been doing this for years because I felt it was very important. As a matter of fact, I brought on some friends from Pocori and suggested they come to PFCC. A number of people that did join, and some of them are on your DEI. So this has always been something I did. I won a Community Connector Award, I think in, I don't know, 2012 maybe, with the the Faith Action Network here locally. So I've always, it's just something I do. I believe, I call it pollinating. What we find from one area, take it to another area. Or, when I meet somebody, I think, oh, they'd be great for this or that. And just yesterday, somebody called from LA actually, who I think she saw something I put on Facebook, and I was kind of complaining a little bit because I'm getting a lot of what I call maybe unpaid headhunting, where they're looking for something very specific. A headhunter is somebody that connects people to professional, professional whatever work. And so I'm getting some kind of high level stuff that's really not particularly in my area of expertise, or it is, but I'm not in industry, right? So I'm connecting people there. Today I just did something, but a gal called from LA yesterday to see how I was, because I had connected her to a couple things, but I wasn't complaining about that. This, these are things I love to do, like, tell people maybe about PFCC partners. I told her about an organization called the Patients Program, and she's out of University of Maryland, and she's graduating from their professors group and getting a certificate with her sister. And right, she's a Latina, right? And so I also told her to apply for the PCORI scholarship and to the annual meeting, and she got it. So, two people I know actually did, who have never been connected with PCORI before, individuals of different backgrounds that we don't always see at the events. So I just, it's something to do purposeful. And if I meet somebody and I see a good fit, I just behind the scenes, I often will share with them opportunities, because, that's just a good thing to do, right? And to pass it forward. And I think you're right about once you get asked to do something, you get asked to, do something else. People hear you speak. And so, or if you're on a TEP, like National Quality Forum, you might be asked to be on something else. So thank you very much.
Thank you. Yeah, and thanks for all the work you do and passing the mic for so long. We definitely appreciate it.
I call it pollinating like a hummingbird.
I like that. I like that too. That's good. Yes, thank you. All right, we'll go ahead and move on. I'm going to invite Mary Schramke, who's part of our PFAnetwork advisory panel, to come on, or advisory board panel, to come on and let us know a little bit about some of our discussions we've had in our last few meetings.
Hello, everybody. It's Mary Schramke. Thanks, Laura. Just a little background for folks, the advisory board. I don't know exactly how many people are on it, but we try to give, we meet on a regular basis and try to give the FCC partner team just a little perspective, a little step back on some of the issues that come up along the way. And our intention is to really make sure that we're as effective as we can be, especially in our training and bringing new folks on board, making it as inclusive as possible, because obviously we want to have partnerships that are diverse and represent all of the lived experiences that are out there. And that's a big challenge, but I think we've all made a lot of progress. Lindsay Galley does a great job of training. There's one coming up. And one of the things that we were talking about is just this triangle of what our basic principles are for being a good partner. And one of the topics that we discussed was just the fact that there's this concept of, how do we approach our work? And, work as a team member, we want to be solution focused. It was has been the concept. And one of the, or there were some good discussion around, is that the right word? Does that put you in the right frame of mind? And one of the things that you'll learn if you take the training, if you haven't already, is that it is about trying to solve problems together as a team. And, it's not so much about what the, negative or positive experience someone had, but can you take that energy and translate that into something that, can be a way to improve things, continuous improvement. It's certainly part of the constructive collaboration, but one of the issues that came up was, if you use the term solution, maybe you have a preconceived notion of what the end game should be. And so there was some discussion about maybe having it be a bit more a broader term. And then, of course, because I haven't had that much coffee this morning, I can't remember some of the terms that were used, but maybe somebody can bail me out. But that was basically the discussion, is that, one of the core concepts is to plan, do, study, and act. And that's sort of cycle of improvement is one where you're trying to, really bring ideas together and solve problems. And so I'll just stop there, and, maybe Rosie or others can, bail me out on some of the words that were used. Sorry, I didn't take good notes.
I actually just went back to my notes. Some of the suggestions were solution testing, continuous learning focused, creative solutioning, solution driven, and solution oriented.
Thanks, Laura. And I would invite others to just think about that a little bit, and maybe reflect a bit on, different teams you've been on, and, or situations you've been in and where you're trying to have that conversation, and just see how, if that, welcome, certainly welcome feedback from others on that, just to keep the concept or the idea of improvement here, just how best to train folks and keep our sort of mindset trained on doing the right thing.
Tausi?
I just think sometimes it's helpful when you're in a really difficult problem-solving situation to not talk about a solution, but an improvement of the situation. In other words, we're not going to find something that just totally solves it, but can we get it a little bit better? What would be better than where we are now? I don't know how to wordsmith that, but that's a good thing to be looking for.
Mm-hmm. Thank you.
Hi,
this
this
is
is
Mary.
Connie.
Oh,
Sorry, go ahead.
Okay,
Connie, did you have a
Yeah.
comment?
I'm with Towsy. Possibly not solution focused, but maybe more on the notion of what he stated. I think he said improvement, so maybe improvement outcomes.
Oh, yeah. I like that. Nadine also said solution exploring, unearthing, uncovering. Libby says continuous improvement, which is a term we like here. All right, well, thank you for all the ideas. We will keep looking at that and continuously improving. And Mary, I don't know if you wanted to go into looking for new advisory board members also.
Yes.
Oh, sure. Yeah, Rosie, go ahead. You can,
Yeah.
it's your turn.
No, that's okay, Mary. Go ahead.
Just to along the lines of what Laura and Libby have already demonstrated today, trying to make it, we discussed ways to try and make it easier to bring new folks onto different teams and to bring them into the family, so to speak, and make things comfortable. I think it's, everybody comes to the trying to improve healthcare from a different perspective. And I know for me personally, my journey was one where I had a lot of emotions about the care for my parents, my mom in particular, and translating and channeling that event, the energy and emotion and passion from that event and all the lessons learned, and then working to build my skills to where that became more broad around exploring ways to make things better and how to be a, better team member, so to speak, and still hold my own place. And so those are the things that we talked about, and certainly we have a lot to learn, and it's really important for all of us to support that any way we can. Rosie?
I agree. And I think that, many times as we look at our board, we need to also look at, what does our membership look like and where are they coming from, and making sure that we have it's a very diverse and equitable and inclusive board. And I think, if anything, we've learned anything from to PFA Network and the PFCC's board is that, you know, Libby and Lindsay and Stephen and the whole group have really helped us open our eyes to lots of things that we weren't aware of, and even our own, you know, and for me, it was like, look at these boards and say, you know, if I need to leave so someone else can be a member, I will do that, because to me, it's like, we need to make sure everyone's represented at the table. And so, you know, that's passing the mic too. That's saying, hey, I can leave to make room for someone else who might be a better voice on this board at this time, in this moment of time. So, you know, I feel really strongly about those kind of things, because, you know, sometimes we get in a rut and we love the work we're doing. And you know, the last thing I want to do is leave this board. But on the other side of it, if it means that it can make room for someone else that really can represent another entity or another part of our community, then I will move on and find another way to pass the mic to someone else.
Rosie, I really appreciate that. And let me just jump into this conversation a little bit. The PFA Network Advisory Board is, as I put in the chat box, just essential, provides essential guidance for the development of this community. It's always been for advisors, with advisors, and designed by advisors. So this is our community, and that's the way we'll always keep it. With that said, even a couple of years ago, we made an effort to diversify our board, and we gathered new members that were more diverse. That was early in our DEI journey. And to be honest, I think we've learned a lot more about, once you're bringing people to the table, how you are truly inclusive. And I think that we may have more opportunity to be even more inclusive of both our new members, but we've also had some attrition over the last couple of years. And a lot of that is for personal reasons. You know, we try to do an exit interview with everybody who leaves. So, you know, primarily, again, we're all patient family partners, and we come to this work because we've got things going on in the background that require our immediate attention. And so there is always going to be some attrition that way. So I'm not sure that we need to unseat anyone to make space. We try, Harvey, to answer your question, we try to keep the board at about 12 to 14 people. And so I think right now, the last few, we've again had some attrition, so we're down around 8 or so. And so we'd really like to consider, you know, opening the space for others to join in. And I will also say that this board has some brilliant ideas for peer mentorship, for developing regional connections and, you know, regional hubs, if you will, for our PFA network. We're so large, we're over 800 people now. So how are we engaging all of those folks, and could we be doing that better? And the answer is yes, we absolutely can. As you may or may not know, the PFA network receives no funding directly. We are not funded. This is something that we do as part of our PFCC partners work. And so we fund Laura's time to coordinate the network through that. So that's another thing, you know, we maybe we're limiting ourselves because we don't have funding sources, and you know, maybe we could do a little bit more. So these are kind of the next challenges for our community as we continue to grow, both overall, but specifically around inclusion and diversity. So I just wanted to open that space, and I welcome anyone's comments, challenges, concerns.
Please forgive me if I'm way off base here because this is the first time I'm on this call, but could you go back to the people or the entities who have benefited the most from your suggestions and get them to sponsor some aspect of your initiatives?
Potentially, yes. Potentially a subscription model is something to definitely consider. But I don't want to pull us too far off, on that track. I really want to focus on the inclusion of, more diverse voices onto our board, because we need to learn. We also need people that will help teach us, quite frankly, right? We need,
Libby, this is Rosie. Maybe I could help her answer this, maybe. Like later on this afternoon, there's the core competency today and next Wednesday. And, I've done that several times, but I signed up today because I had the time, because every time I've gone, there's been different voices at the table, and we learn from each other. And that is what the PFA network and advisory board is about. That is what the PFA network is about all the time. And all of the learning that I've done through PFA network, and I pass the mic about this all the time, because I believe that you really prepare patient advisors in a way that no other group prepares them, because you do let us all have our voice. And so if you've signed up for core competency 4 years ago or 2 years ago or a year ago, and you sign up again, you're going to learn something different and something new, and it's going to be different because you're going to have different people, and it's their stories and their experiences that you learn from. And if I've learned anything, is that story drives quality improvement, it drives learning, it drives everything. And the sooner that healthcare learns that, the sooner healthcare is going to improve. And I'm hearing trickles of it in other areas now.
Mhm.
Other groups are starting to say, well, what's the story? What's the story? Before they, and they really want to know the story and connection to quality improvement. So, being an entity that's, being a part of this, receiving, I think, the rewards of this, I look at it as the rewards of what you do. Any entity that connects with you is going to be rewarded hundreds of folds. And so, the entity is that you're going to get over 800 voices, and maybe not all at the same time, but at different times along the way. So it's, I think it's really important that this board and the network is looked at as being, a group of people who really care about patients and patient improvement in healthcare quality.
Thank you so much, Rosie. Barbara? I don't know if that
I
was.
forgot what I was going to say, because Rosie, you're just so damn articulate. It gives me chills. So thank you for
Me
saying
too.
what you said. But what I was going to say, I think, had to do with you were talking about more diversity on the network. By the way, I have been on the advisory board for a few years, and it has been one of the most important experiences in my life, and not just as a patient or a family caregiver, but just by being in such an extraordinarily respectful and collaborative space has taught me so much. I was just wondering, Libby, I know that you're starting to do work doing either simultaneous translations into other languages, or somehow bringing other languages, onto the platform. I wonder if advisory board meetings were bilingual or even trilingual, if that might attract different members, who might be Spanish speaking or another language speaking, primary language.
I'm sure it would. I'm sure it would. We have a wonderful partnership with LA County Department of Health Services, who is actually providing the translation for the core competency. So Lindsay's doing the core competencies today with Spanish translation on board, which is super exciting and a big next step. So we are continuing to move forward in that. You know, we were lucky that LA County, you know, Nadine, kind of going back to your thought, one of our great partners offered to supply our translator, or our interpreter. We've got the platform on Zoom. We upgraded so we could have that interpretive services. And we've had some real challenges between technology challenges and people who were used to doing things a certain way and did not appreciate the additional opportunities. So we're working through all these problems, and I think in order to do it well, I need to have a little bit more in place, but we definitely continue to move in that direction. Well, I think you will all see more coming out around new advisory board members, and would invite you to really consider it. If you are thinking maybe it's someplace that your unique perspective is needed, please reach out to Laura and or myself. And if you need answers, questions, what the commitment is and all of that, we'll be happy to share that with you.
Yes, thank you. And I did see your question in the chat, Lori, about time commitment and expectations. And we will get all of that out once we start the call for advisory board members. But again, you're always more than welcome to email any of us on the team with any questions. All right. The PFA Network group on Facebook. Yes, but we don't,
Yeah.
It's not active currently. We tried social media for a while. None of us are super savvy at social media. So.
And it's unfortunately just that one thing that is beyond our reach with the four of us.
Yeah.
And we had
a bunch of millennials on our team, we would be, but no.
I'm not the millennial. Anyway, yeah, so we really have struggled with that, but it's not active.
No. Yeah, social media is definitely a lot of work.
And just as a matter of a bit of a team update, Lucero Cuevas, who has joined us as our administrative coordinator, is happily out on maternity leave. Baby Samuel arrived last week, and he is doing well, and she is doing well, and big brother Danny is learning his new role. So they're enjoying that time. She will take her full family leave and will rejoin us in January. So excited for her and her family. Stephen, you may have noticed, has been a bit MIA recently. He first had a pretty good case of COVID himself, but I'm very happy to say he has recovered. But he also got married on Saturday, and so is enjoying some time off as well. And it was a great family celebration. But anyway, so Laura, Lindsay, and I are are moving along. So we'll ask for your grace and patience if it takes us a minute to get back to you on any particular thing.
Yes, thank you. All good things.
All good things. Yeah.
All good
Well,
things.
except for the COVID, but yeah.
Well, yeah. But you get the skeleton crew for a little bit.
Yeah, a little bit more.
Yes.
Well, congratulations to Stephen and his bride.
Thank you. Thank you. She is a wonderful woman from South Africa. So her family was here from South Africa and joined us for a couple of weeks. And we got to learn about their cultures, and they learned about ours. And it was just a really fantastic thing. She's a safari animal veterinarian. So she works on lions and rhinoceri and giraffe in the wild. She's quite something. At all
What's
of
she gonna
5'1".
do here? What's she gonna do here?
Oh, she has a lot of research going all over the world, and the
Okay.
She's working with a lot of zoos here in America to help them
Okay.
keep their animals healthy. Okay, I'll stop bragging about my family.
No, we love it. I'll actually keep it with you here for the discussion.
Yeah. So this being a town hall, one of the things that we really want to do on these quarterly meetings is hear from all of you as active patient family partners in the environment, whether it's with your health system or research teams or quality improvement organizations. What's going on out there? What are you, challenged with? What are you thinking about? What are you seeing as future areas of that we as a community really need to move our focus to? We've told you a little bit about our focus on diversity and inclusion to build equity, but what else do we need to be thinking about? So really just wanted to open the floor to folks to let us know. Janice?
Hi, I'm all over the place, so I still think trustworthiness and relationship building is some of the major areas, as well as, community involvement. And, but I'm really seeing trust, trust is popping up everywhere. Because when we're talking about expanding, PFA, the truth is that trust in clinicians and health systems overall are very, very, very low, right?
Yeah.
And they
Yep,
were low
for sure.
before COVID, but it's like, 30, 40, it's very low, which is very sad. And I think primary care is something that we could work on where, if people get involved with primary care as sort of like, if you're connected to our primary care, I was just on a podcast yesterday with UCSF, Siren. I don't know if you know who they are. They're worth looking at. I can put the report in the chat, but they found out if people were connected to their primary care physician, then they were more likely to be receptive of collection of social determinants of health, which is a huge deal right now. You'll learn a lot about that at the putting care at the center, but how do we collect social determinants of health in an appropriate manner? There should be different modalities. It'd be great if we could do it in story form, but it's not usually what they like. So those are some of the forefront, but really primary care is really taking a toll. Doctors, the workforce is really in a bad space right now. Nurses, doctors, everybody. And how we can support them is something I think we need to just have a little bit of a tide turn a little bit where, how reframing how we can help them with, advancing better health at the right time in the right place or whatever.
Great. Thank you so much, Janice. Emily?
Yeah, I hesitate to speak because I was a patient partner advisor, but now I'm an employee actually bringing other people on board as advisors and patient partners at Kaiser Permanente. But one of the things that we came up with during COVID, partly because of just the challenges that staff were facing and trying to find new ways for them to bring in the patient voice, is what we call listening sessions. And we encourage the staff to bring us issues where they don't have, okay, here's an improvement we need to make, and we need, it's like we've got it down what the problem is. Get it to it earlier, and we'll work with them to come up with the basic questions they need to ask. They'll send us a list of 20 or 30 or 40 patients who had the experience. The team I'm on will call them. It's of course completely voluntary if they let us interview them. And out of those we do interview on the phone, we invite as many as are willing to come to a 2-hour video call. That's why we call it a listening session. Someone will act as a facilitator. The staff who want the information mostly listen, and we'll just talk to the patients like, okay, what happened when you realized that you needed to come to the office? What worked and what didn't? And what happened when you got the care? What worked and what didn't? And go through in detail. And then at the end of the session, we will compile all the information from the phone calls and the listening session and send it to the staff, and they'll look at it and say, there's a place where we need to make a change and improvement. And now we've got a concrete idea because of this in-depth feedback of what the changes need to look like. And so it's helped us get more opportunities for people to provide input and made it easier on the staff because we work with them as to who has to do how much work.
Thank you so much, Emily. I love that more open and inclusive kind of format, but also more immediate to getting the information out to the staff. That is fantastic. And please don't ever hesitate to speak up or join us for these. I think, you know, knowing your path forward from being an advisor into that role, we have others on the phone that are in the same situation. And so I would consider myself in the same, that I started as a patient family partner. I'm still a patient family partner, but do some other things as well. So please, we embrace that perspective as well. Just wanted to do that as an aside. And it's nice to see you. I haven't seen you in a long time. Barbara?
Three topics that I have come into contact more with, both in conversation and also in articles and literature. The first is the desperate need for greater representation in clinical trials.
Mm-hmm.
You know, if a clinical trial doesn't include various populations, the results will come out, the results will be touted as evidence-based, but the evidence will be biased.
Mm-hmm.
And therefore the practice will be biased. That's one. The other is this topic of gaslighting and how patients and families can be gaslighted in their experiences with providers. And what that means is kind of that you can be very, very subtly dismissed in ways that might just go right by you. You know, one example is I've stopped counting the number of times physicians or clinicians have said to me, you know, that's just what happens when you get older. You know, that's a form of gaslighting.
Mm-hmm.
And the third topic is clinician burnout. It's massive and it's growing, and people are leaving. The nursing shortage is a crisis now. And the question of what can we as patients and families do to support the well-being of those people who take such excellent care of us and get the kind of care that we need and deserve, so that it's really, so that the concept of patient and family-centered care is really about a two-way relationship. So that the patient and family get the care, but in getting the care, you're also creating the kind of partnership with your care team that uplifts them during these hard times.
Great. Thank you. I appreciate those insights. Rosie?
I put this in the chat, but you know, as we focused a lot on COVID and now we're focusing on monkeypox, what has happened in the background, and lots of people aren't talking about it, is that all of the other healthcare acquired infections, especially MRSA and C. diff, are on the rise. MRSA has tripled in the, you know, and it's not just in the US, it's across the world. I mean, I have friends in Copenhagen, I have friends in Singapore, I have everywhere across the world. I mean, the World Health Organization contacted me to talk about hand hygiene and the rise in healthcare acquired infections. And basically, I firmly believe we need to go back to the basics. And I did send out a half-hour presentation that I did with a doctor that works for Telegen last week. It's called Back to the Basics. It's for infection preventionists, but it is good for everybody. And it's about environment and hand hygiene. And you know, it starts out with me telling a little bit about my story and the work I've done, and then he talks about, you know, and definitely related it well. And one of the things that will never leave my mind again is that the bed rails in a hospital bed, they are touched 856 times a day. An IV pole is, 856 times a day. Do you think they're wiped 856 times a day?
Yeah.
And we don't think about that as a way of passing an infection. You know, IV poles are another one. We take IV poles to the bathroom. We take IV poles. And I can tell you, I've been in the hospital sometimes 25 to 40 days, and nobody's ever wiped my IV pole. Unless I brought wipes it and David wiped it.
So I really appreciate this conversation, Rosie, because you know, we know from doing work with our QIO partners and our hospital quality improvement partners that you're absolutely right. The infections are coming back out. You know, we're backsliding on things. So I appreciate that the conversation has a sense of urgency behind it right now that we can be supportive of. Thank you.
Right. Well, and part of it is surveillance. I mean, we've put all our surveillance on COVID and so what happened in the rest of the hospital, there was no surveillance of any kind. And
yeah.
If you had a hospital experience other than COVID during during the last 2 years, you will understand this.
Yeah.
But it's
definitely,
it's just important. And then the important part is to tell the stories, and the stories will tell you why you don't want, you know, my theory is, you know, originally 13 or 12 years ago was made the video, one is too many. I say one is still too many. You know, that's
true.
I mean, it's just one is still too many, and we need to make sure we don't. And part of it is, you know, just way too much required, way too many requirements. We keep adding to the providers list, but we don't take anything off their lists, off the table ever. So it's just a lot of different things.
Thank you, Rosie. I appreciate that. I'm going to grab Connie's last comment, and then I know we're just about at time. Go ahead, Connie.
Since we're just about at time, I just like to say it's going to have to somehow be a two-way highway and a two-way street between provider and patient, in both, considering the whole being of each other. Most of us have a lot more going on in our lives than we are willing to discuss anyway, openly. We are complex beings, mentally, physically, and emotionally, definitely financially and spiritually also. And trying to balance all those issues of life is most difficult. So in any time we connect with any other individuals, whether it's personal or professionally, we're gonna have to look, listen, learn, and then connect. That's all. Thank you.
Connie, I really appreciate that. That's an excellent reminder. And if any of you want to add things in the chat box, we'll leave that open for a few more minutes. Laura, do we have anything else?
Just what was on your mind?
Yeah, I think we've got a pretty good look at that.
Yeah. And that's all.
But we always, our ears are open, and you know, we create a stronger community based on what you all share with us. So I really appreciate that. And Connie, I just quoted you, so I keep that on a sticky on my frame, my computer frame. Patience and grace all the way around. Yes. All right. Thanks, everybody.
Thank you. And we will add this recording along with that last discussion question into the forums, just like we do with our coffee chat. So if you have more to add, feel free to add it in the forums or email any of us on the team. All right. Well, thank you for joining us, everybody. We'll see you hopefully next Friday at our coffee chat, or later on today for core competencies. Lots of fun stuff. Thanks for joining.
Thank you. I just wanted to say too that through all this COVID and everything, you know, our clinicians and providers have family members that have died, and they've gotten very sick too, right? And they're just, you know, so we forget that. We do realize they come from a different perspective, but they are also patients. So anyway, take care.
Thank you. Thanks for sharing.